Hello. So I haven't made a video in a while for a couple of reasons. One is that I had like a couple of doctor's appointments and I wanted to finish my doctor's appointments before I made another video so I can update you guys on that. Also, another reason is because the last treatment that I had, I just haven't been right ever since. I'm usually okay by now, and actually, I will say Thursday, Thanksgiving, maybe Thursday, Friday was the first day where I felt like 100% myself, except for just being more tired than normal. But that last treatment was really bad, and it just wiped me out completely. So that was another reason. Also, another reason is that I ended up getting another infection, breast infection on the left side, not the side where the cancer's at, but on the left side. That actually caused me to have to go to urgent care. The breast infection, I mean, you can feel it. It's extremely painful to where you can barely move. So I dealt with that for about a week and I was putting hot compresses on there. It just wasn't budging. And then one time when I took a shower, I realized the infection was spreading. It was going up towards my entire breast. It started at the very bottom underneath and it's just started going up to the top. So that day after I got out of the shower, I went ahead and I went to urgent care. That was on Tuesday. Well, I have had to go to urgent care every single day this week. So they ended up draining the infection and collecting a sample to send it off to the lab to figure out what type of infection I have. But the draining process was extremely painful. That they like cut you with a scalpel and all this stuff starts coming out. I'll leave the details for you to figure out. But anyways, it's just really bad. So since then, they gave me instructions to return to urgent care every day. I've had to do IV antibiotics every single day for 7 days. Um, and they also have to pack the wound. So every time I go, they unpack it and then they repack it. And once they're done with that, they hook me up to an antibiotic IV that lasts about 30 minutes and then I can go. So actually, I'm on my way. I'm going to be leaving to urgent care soon um, so that they can do this process again. So yeah, I've been kind of MIA because of the infection. Also, I had a appointment with the plastic surgeon. So the plastic surgeon is the surgeon that will be doing the implants once everything is done. So um, that appointment didn't go as planned. I didn't know that the process was so drawn out. I don't know. I wasn't thinking that the process would be as drawn out as he explained. Because in my mind, I've seen so many shows where, these females go and they get implants, they go home, and, you know, that's it. Well, I guess it's different for me. Number one, because I'm having a double mastectomy. So my regular surgeon will be doing the double mastectomy. And right after she is done, the plastic surgeon will they will place what they call spacers inside. Um, and they stay for 6 months. I wasn't expecting that. I thought maybe a couple of weeks, but he said 6 months. Then after 6 months, you go back and that's when they do the implants. The spacers, basically, I guess you could say, are like temporary implants. They're just preparing, it stretches out the skin or whatever, so that when he does the implants, they just slide it right in. I wasn't expected for that to be 6 months and then for me to have to go back. So he said I can do that. My other option would be to take skin from another part or tissue from another part of my body and then transfer it to my breast if I don't want to do the implants. But the problem with that is that I keep getting breast infections. So he did say if I get implants and I have a breast infection, they will have to go back in and just remove them. Or he can do what they call a delayed reconstructive surgery, where they do the double mastectomy. They don't put the spacers. Wait 6 months, make sure I don't get an infection. Then they do the spacers. Wait another 6 months, then they do the implants. It's a lot. So he's supposed to be talking to my surgeon about what he discussed with me so that they can try to figure out the best course of action. But ultimately, it is my decision on what I would like to do. Both surgeons feel like the double mastectomy has a good chance of removing all the tissue that is causing infections, but they can't guarantee you that. So that's something that I needed to think about. Then I had an appointment with my oncologist on Wednesday, and I told him that this last treatment was not very good to me at all, that it was really bad, that I wanted to just give up and not do it anymore. And I asked him, I said, was it bad because you guys gave me extra because of my second treatment? I don't know if you kept up with the videos, but my second treatment, they only gave me one of my chemos, and they didn't give me all of them. So I thought that when I went last time, the reason why I was so sick is that they went ahead and they put the other one, gave me the other one that I was missing, and that made me just more sick. And he said that that's something that they would never do. They wouldn't just pack on whatever they missed and just give it to me. They won't do that. They can't do that. And he said that it was the same as my first one, which I told him, and other people agree, that there was no way that was the same, because I was there for a very long time. I was there for an additional hour than I had been before. Usually it takes about 4 hours for my treatments. The last time it took 5. But he assured me that it wasn't anything that he put in to say, okay, you missed one, so let me just pack on another one. He said he didn't do that. So the only other explanation is that the bag with one of my chemos had a little bit extra in there. And what they did is they just gave it to me. So I explained to him that that experience was really bad for me. I also told him that the stomach pains that I'm feeling that whole time is just really bad. So he did prescribe me something for that. I also was feeling joint pains, which is a side effect of chemo, all the way down from my legs, the top of my legs to my feet. I mean, you're laying there and your legs are completely just hurting. It's like a pain. So I was taking ibuprofen for that, but he said to not take ibuprofen because it can also, like, make my stomach hurt as well, and I'm already having stomach pain. So he told me that he can prescribe me Norco. When I heard Norco, I was like, nope, I'm not taking that. Um, and then he said, okay, well, you could just do Tylenol. So I'm gonna be trying Tylenol. But I'm not a fan of Norco. Um, I don't like things that make me drowsy or make me fall asleep and stuff like that. So I'll try the Tylenol, but he did also say that he will lower my dosage. This treatment, my next treatment is actually on Tuesday, the 29th. I feel like I haven't had a chance to get back to myself, and I'm already turning right back around to have another treatment. But he said he's going to lower the dosage and see if that helps. And he also said, which kind of made me upset, because I told him this treatment coming up should be number 4. And he said, no, it's not number 4, it's number 3. And I told him no, because I've been keeping track. I know exactly. You can't tell someone that's going through hell and keeping up with their appointments and knowing when they go to treatment, and you can't tell me, you know, what number of treatment I'm on. Believe me, I know better than anyone else. So I said, no, this one's 4. He said, it would be 4, but unfortunately, it's considered 3. And it's considered 3 because the second treatment, they didn't give me all my stuff. So that made me angry because I needed something to look forward to, and my thing to look forward to was February 21st. That would have been the last day. That would have been my last treatment. But since they messed up and they didn't give me all my treatment, now my last day is like middle of March, which throws off everything because I was supposed to have my double mastectomy surgery the end of March. Now I can't have that until April. And now me looking forward to February 21st, it's nothing to look forward to anymore because I still have another treatment after that, which it just makes me mad because that's not my fault. I go there, I get my treatments, I sit there, they start up everything, and that's it. So, whatever happened, when it happened while I was there, that's on them. I didn't purposely miss a treatment. It was just not fully administered to me. So yeah, so I'm delayed there. Um, and like I said, I'm going through an infection right now. Um, and I have treatment again on Tuesday. And my hair is still steady falling out. I um I am noticing hair on my eyebrows. I don't see that fallout. Um, I just noticed that I have like spots or where hair is kind of missing from my eyebrows. And if you know me, you know I have the thickest eyebrows known to mankind. And they're very, very dark, black, full. But I do notice some spots where the hair is missing. Um, if you also know me, you know I have pretty hairy arms, but I'm not seeing any hair fall from that. I am noticing a little hair when I shower and I wash my legs. Um, little pieces of hair is on there, so it's coming off. Like I said, the hair on my head is almost gone. We were supposed to do something like a little ceremony type thing, get together to shave my head. And we were supposed to do that about a week ago, but I've been so sick from this last treatment and not feeling up to myself that we never got around to doing it. We I'm thinking maybe next time we could put it off until the next time I'm feeling good. But the problem is, I don't know if I'm gonna have everybody in because the mess is coming out bad right now. Let me just show you. So the last on Thursday, I wore a wig for the first time ever. It was very uncomfortable, very uncomfortable. So I wore a wig Friday, Thursday, Friday, and I wore one Saturday. I'm not a wig person. Um, and I'm sure people that wear wigs on a regular, I guess they gotta get used to it as well. But that mess, I guess it's just not for me. Um, I don't like it. I don't feel like the wig suits me. Everybody else says it looks nice. I don't like the way it looks. But I wore it because I'm wearing a hat to Thanksgiving, and plus the type of hat I have has like an opening in the back a little bit, and you can see that I'm basically don't have no hair. But I wanted to show you or share a clip of me when I was to just comb like the ponytail of my hair so you could see how much hair comes out, but I can't do that because my cousin, she went ahead and braided two braids in my hair like late on Thanksgiving. A lot of my hair came out too. Um, oh, while I'm showing you some, these are my eyebrows, and if you look really good, I have like spots that are missing up in here, up in here. They're really missing, and of course my hair. Um, my hair starts here. All this is gone. Same thing all the way around. Um, I can't really show you the back. I could try to show you. I can't show you the back, I'm sorry. But the back is the same way. There's no hair. It's a big bald spot, kind of like right here in the middle. And the hat that I wear has this opening in the back. So when I put the hat on, you can see just a bald spot, you know. So I try not to wear the hat outside anymore because it serves no purpose. Um, but since I'm going to urgent care um, now, I'm probably going to throw this wig on that I hate and wear it while I attend my appointment. So I'm going to show you the wig. It's about a little shoulder's length and it's curly. I just still don't like it. I don't like anything. And then for me, I feel like when I take the wig off, my head just be sweating and stuff. Like, I don't like it. I don't. So this is the wig. It's just got, you know, a curl to it. Um, I actually brought this wig, believe it or not, a little over a year ago. Um, I was hearing a lot of hype about what they call a headband wig. I was like, oh, I think I want to try one. So I brought it on Amazon and it came in the mail and I just left it in a box because I'm not a wig person. I never took it out. I never tried it on. First time that I wore it was Thursday. Um, so I've had this wig for a little over a year. So this is what the wig looks like. It has Velcro in the back where you take it and you Velcro inside, and it looks like this. Now, I don't like it. I feel like I look like maybe like Milli Vanilli or something like that. I don't like it at all. It just doesn't fit me. Um, but I guess it beats walking around, like this. So, yeah. So those are my updates. Um, I know I had a lot of people tell me that the last video I made them feel emotional. And like I said, I was going to try to record as much as I could, regardless of how I'm feeling. And unfortunately, I was just not feeling well. It wasn't a good experience. The last treatment wasn't good to me at all. I can only hope it gets better. Um, he said he's going to lower my dosage, so I'm keeping my fingers crossed. You got I got my daughter's birthday coming up. Then Christmas is right after. And I don't want to be sick for those occasions. But I don't really have a choice because my chemo is on certain dates. Um, I can only hope that I'm better. Like I said, when I'm doing well, my kids seem to be okay. But when I'm doing bad, you can tell on their face that they're more concerned. So I try to put on a brave face for them, which has kind of been working. But they've been a very big help to me. So I'm definitely grateful for my kids. And definitely grateful for my family. I get a lot of people checking up on me, seeing how I'm doing, which is fine. I don't mind, but let's not be a little overbearing, guys, because sometimes I have people that literally every single day. And when I say every day, I'm talking like, didn't you just ask me how I was doing yesterday? If I told you I was doing fine yesterday, then I'm probably going to be fine today if you know I didn't have treatment yet. And, I don't want to be mean. That's not me to be mean. But please know that the week that I have treatment, I'm not going to be able to answer your calls. I'm not going to be able to respond to your texts. I'm down. When I'm down, I mean I'm down. I sometimes I don't even pick up my phone to even look at it, you know. Um and if you call me, I'm not going to be able to answer. So just give me some time and I will get back to you. I appreciate people checking up on me. But once I get past that little hurdle, which is usually lasts me about a week, I have treatment on a Tuesday. So I'm usually down until that Tuesday or Wednesday, that following Tuesday or Wednesday. And then after that, I'm slowly getting better. So, I mean, you don't have to check up on me every day. I'll try to make videos as often as possible because I'm pretty sure that the reason why I keep getting people checking up on me so often is because I haven't made a video in a while. But I did that because I was actually going through another breast infection, which they explained I'm sorry, I was going to end this, but here's the kicker, which I didn't even know. So I told them that it seems like every single time I get a treatment, my infections start to flare up. I can feel them. They may not flare up fully. It's like the beginning, like, oh, something's gonna happen. And then sometimes it just doesn't like go through all the way. But I every single place where I have had infections after each treatment, they start to flare up. And my oncologist told me that the reason why is because of my immune system. So basically, when they give me the chemo, just to consider myself as not having an immune system at all. So my body cannot fight anything. So when I have these infections, they flare up because I don't have an immune system to fight it, which makes sense because this last infection, it started a few days after I had my treatment, but this just happened to get so bad I went to urgent care. And Tomorrow I have to call my surgeon because urgent care doctors are saying that I possibly need surgery, which is the last thing I want to have to go through. Considering, like, am I not going through enough? I don't want to have to deal with surgery, especially while I'm going through chemo. So we'll see what my surgeon says when I call tomorrow. Anyways, I will not be doing another video until Tuesday, the 29th, which will be my next treatment date. I almost feel like I gotta rename my videos because I've been putting treatment number 1 or treatment number 2, and now he's saying like I'm pushed behind. But I'm gonna just keep numbering it the way I feel like it is in my head, and then when that last treatment date come and I have to do another one, I'm gonna just mark it as bonus treatment. I don't know. Also, I'm thinking about kind of just not mentioning the word chemo. Every time I say it, I feel it. I know it sounds weird, but every single time I say chemo, immediately I feel the symptoms of it. It's weird, but it's almost like a reminder when you say it. It reminds you of how bad you felt when you're taking it. So I don't think I want to use that name or phrase anymore. I'll probably just call it, I don't know, healing drops or magic drops or something. Because saying chemo it doesn't work for me anymore. But for the sake of the video, when I post my videos, for the titles and stuff, I will put the word chemo there, but I just don't feel like saying it. It just makes me feel ill inside. Anyways, again, thank you for watching my videos, watching my journey. Thank you to my friends, my family, all of those that are in my immediate support group. You know who you are. You know exactly who you are. Anybody that's helping me in any way, shape, or form, I do appreciate you. And I hope you can continue to help me. But hopefully I'm back to myself in no time. But I do appreciate everyone. And again, I will make another video. I won't be making another video until Tuesday. So I hope everyone had a good Thanksgiving. And I will talk to you later. I'm on my way to urgent care. Bye.